5:30 Connect to the Capitol. Lots to talk about in Rhode Island, from big announcements at the Rhode Island Attorney General's office to a new phase with the Washington Bridge project as we get closer to the rebuild. And as always, the governor joins us live in studio. Governor, always appreciate your time. I know you're a busy man.
Yeah, well, thanks, Dan. Thanks for the invite.
One of the big issues that I'm hearing from our viewers and from people around Rhode Island is the anxiety and the fear because United Healthcare is kind of pulling back on insuring at a lot of local hospitals. I wanted to see what you were doing. Are you involved? What's happening?
Well, we're gathering more information. That's new information. The issues are it's a federal issue, and it's also a negotiation issue between the hospital, Brown University, which was former Lifespan, and United Healthcare. So we're gathering more information, and then once we see the impact or understand the impact, certainly we'll be weighing in.
The impact, as you see it right now, though, looks like it does impact a lot of people, right? Thousands and thousands of people.
We don't have the number.
Okay.
And I haven't read anything published today about the number. We know that it's a the issue that has to do with Medicaid Plus, I believe it is.
Advantage.
Advantage, yeah. So we got to get more information on it. Again, we got to make sure that the hospital and the health HMO are talking and making sure that they have the information to be notifying and to tell people what's happening.
Right. Do you have helplines that you have set up or for people?
Yes.
Okay.
Yeah, and I don't have the number in front of me, but I think we shared that.
We put it at the bottom of your screen right here. So tell me what this number is for and who people are going to talk to when they call it.
Yeah, I'll be talking to somebody at the Department of Health.
Okay.
And you're getting updated information based on what information that we have and has been verified.
Right. Healthcare insurance in this state, as in a lot of states, is getting people a lot of concern because it's going to come down to basically 2 hospital companies that are running, and insurance is going to be tough, and they have a shortage of doctors. You know this. You've said you come up with a plan just a couple of weeks ago.
Yeah, it's a national issue.
Right.
We're not the only ones that are going through this. I don't think that we're going to be down to 2 hospitals. I think that we will have maintain the hospitals that are in place right now. We're working through that.
Right.
To potentially
two operating companies is what I meant. Yeah.
Yeah, and so I think that look, we're going to make sure that we're doing everything we can protect the rankings that we have, which we're in the top 5 in the country in our healthcare area. We're going to maintain that, and each one of these challenges that we talked about, we're addressing, which we have recently, and I went over a whole litany of things. And those things are working, by the way, in terms of the $5 million we put out for the different incentives for primary care offices to bring in docs, to bring in patients. That's working, and I'm certainly be willing to share the details as they become more available.
Awesome. And we're also going to have that phone number on our website for all of you watching at home. Ken Richards on Facebook, he's a viewer, said, would you be open to for-profit independent emergency rooms and more privately owned hospitals?
Well, I think that we got to make sure that we have enough health care to service the people in Rhode Island. So all options are available, and I think that we would certainly work through that. But right now, we're faced with making sure that 2 hospitals, the St. Joseph's there, hospital is that continues.
Okay.
And that's going from a profit to a nonprofit. Our most biggest concern is that there is care
and there's insurance, right? Because they need insurance. Can we move on to the Washington Bridge? June's a big month, isn't it, for us in terms of picking contractors and moving forward? Can you tell us where we stand?
Yeah, we have 2. First of all, the bridge is coming down. It's being demolished, and that's good news. We have 2 contractors that are nationally recognized that are bidding on the rebuild of the bridge. We will have news in the first week of June, so that we'll have a timing and we'll have a price structure so that we can share that with people and then continue to monitor the traffic flow and the impact that it's having on people.
So once you pick a contractor, we're gonna move fast forward or move as forward fast as we can.
What's good is that we have 2 nationally recognized contractors that have been bidding on this over the last 4 months, 5 months. So we know we're going to get a competitive bid, and we're going to get a competitive time frame and price. And then as soon as we have it, like I said, we'll share that with everyone. But I still meet weekly to make sure that I know what the traffic flow is, the accident count that's there, the impact that it's having on people. And we're doing everything we can to reduce the the disturbance that it's had on people's
Yeah,
lives.
and it has had a lot. In this very studio earlier today during a taping of 10 News conference, Attorney General Peter Nerone told us that he was open to running for governor. I just want to play a soundbite so you can get the full context.
If I do run for governor, I'll be able to point to accomplishments.
Okay.
No doubt. But I think I should be able to. If you are in office and you can't point to things you've done successfully that the public can appreciate, you don't deserve to be in office and you don't deserve the chance to run for governor.
He's been coming after you a lot. What do you think about him running for governor and going after you like that?
Well, everybody has the right to run for governor.
Yeah, but he seems like you can't say it's Monday without him saying, no, you're wrong. So I'm wondering.
Yeah, I mean, like we said last time, he wears his agenda on his political sleeve. He's been using that office politically to impact the 22 election. He said he didn't vote for me, and he ran like I said, a very bogus investigation that cost the taxpayers hundreds and hundreds of thousands of dollars. And he continues to it. So he's already been on record saying he wants to be out of office in 26. So at least he's being honest about it, right?
Right.
But my feeling is, look, we'll run a campaign and we're going to put a litany of issues in front of people about what we've accomplished since I've been governor. And it's not small, from the economy issues to putting people to work, the school improvements. We've closed the gap on the reading with Massachusetts by 34% since I've been in office, 18% on the math. The data will continue to flow, and we don't have time to outline all the things that we've done.
Let me hold you there, because we're going to bring you back for a second segment, okay? We might as well just give Emily the day off. But anyways.
I'm getting extra time today.
There you go. We'll have more questions for you from our viewers coming up after this. Stay with us, everybody. And we are back with more of our Connect to the Capitol. The governor is nice enough to stick around for our second segment here. I just want to know, have you had a chance to rethink raises for your cabinet? The House of Representatives basically said, not that we don't think they deserve them, but bad timing. The Senate obviously was a little bit different. Have you had time to reassess? Do you still think this is the time?
No, I think it was the appropriate time. And remember, the only time that you get to do that is during March. So that select group that's the only time you actually can put that forward. It becomes a very public issue, and we're going to stay competitive. And I believe that in the end, the Senate got it right, and I think that we're going to move forward and make sure that we stay competitive and keep good people in positions. We have very, very good people, Dan, in positions right now that are doing significantly. Strong work. Okay,
let's talk a little bit about the settlement that was announced, the $11 million for the contamination of Barletta at the 610 thing. A lot of people are questioning the Attorney General and why he has the power to determine where that $11 million is going, or where some of those millions are going. Were you taken by surprise by that in terms of does he have authority?
Well, he doesn't share those pieces of information with our office. Apparently, he said he had some conversations with the House and Senate. But look, appropriations, in my mind, are a function of the General Assembly, and whether the funding that he recommended to go to a place, whether it's on the dental care, which is a good thing. But to me, it's a decision that the General Assembly should be making. If I had brought in a serious amount of dollars, which I think we will on the bridge lawsuit, we're certainly going to have a pending lawsuit on the issues that related to the cyber breach, right? Those dollars should be going into the General Assembly, and then we should be negotiating with them.
Right. They're giving me a hard rap, Governor. I want to be respectful. You think he's overstepping?
I do.
Okay. Governor, thank you for sticking around and answering the questions, right? No holds bar. We certainly appreciate it. Emily?